A human's brain needs a constant supply of blood to work properly. Because this blood brings the oxygen and nutrients the brain cells require for their survival. This blood supply travels through arteries, the vessels that carry blood from the heart to the brain. But how do these arteries become the reason for the disruption of blood flow to the brain? Let's find the answer to this question in this video. In a normal artery, this flow is smooth and uninterrupted, ensuring everything functions as it should. But sometimes, problems arise. When fatty deposits known as plaque, or clots, build up inside the arteries, they can cause a blockage, and that's when things turn dangerous. This disruption in blood flow can lead to a stroke, medically known as a cerebrovascular accident, or CVA. It's a serious emergency where parts of the brain begin to die because they're not getting enough blood. Now, let's take a closer look at the two main types of CVA, each with its own cause, impact, and treatment. The first one is the ischemic stroke, which is also the most common type of stroke, making up about 87% of all cases. In this type of stroke, a blood clot or fatty deposit blocks a brain artery. That blockage cuts off the oxygen supply, causing brain cells to die rapidly. This stroke is most common in individuals aged 71 to 80. And because brain damage can happen within minutes, emergency treatment is critical, including clot-busting drugs or surgery to restore blood flow. While ischemic strokes happen because of a blockage, the second type of stroke is caused when a blood vessel ruptures. A hemorrhagic stroke happens when an artery in the brain bursts, causing blood to leak directly into the brain tissue. This type of stroke creates pressure in the brain, which can damage or kill brain cells. It typically affects people aged 60 to 70, and often requires urgent surgery to stop the bleeding and relieve the pressure. After surgery, medication plays a key role in managing the damage and preventing complications. Recovery can take time, but quick action can make all the difference. So, whether it's caused by a blockage or a burst vessel, a stroke is a serious medical emergency that can change a life in seconds. But with awareness, fast action, right care and recognizing the early warning signs, recovery is possible.